Most seniors after 60 are told the same thing when changes in neck posture begin creeping in. Stiffness, headaches, and limited movement are brushed off as just aging, and the usual advice is painkillers, massage, or simply learning to live with it. Yet, many older adults follow that advice for years and still feel their comfort and daily independence slowly slipping away. So, in today's episode of the Senior Health Podcast, Japan's oldest practicing doctor breaks down the best exercise for cervical rectification and how you can finally find the lasting relief you've been searching for. He's sitting right here with me, and doctor, before we begin, what should our listeners expect from this conversation? Understanding and hope, John. I will explain why neck pain and cervical rectification are often misunderstood and why quick fixes rarely address the real issue. Then I will reveal the single most effective exercise to restore healthier neck alignment and support long-term comfort that has already helped over 7 million seniors. I'm eager to hear this. I was just reviewing research from the Journal of Orthopaedic and Sports Physical Therapy, showing that more than 40% of older adults with chronic neck pain show reduced or reversed cervical curvature on imaging, and those with untreated rectification report significantly higher pain and stiffness over time compared to those who address it early. It is so interesting because it makes you realize how different aging could feel if seniors understood this sooner. Most do not realize that cervical rectification develops quietly, long before constant pain or headaches appear. So before we go further, I want to invite everyone listening to comment and stay with us. If neck stiffness or daily pain sounds familiar, type 1 in the comments. Thank you, doctor. Now let's begin with this very important question. Okay, what is the single most important insight every senior needs to understand about cervical rectification before trying any exercise? I would say the most important insight is that cervical rectification is not a random floor or a sentence of H. It is a slow adaptation to how the neck has been used day after day, often in flexion and tension. After 60, muscles lose elasticity, discs lose hydration, and the nervous system becomes less forgiving of constant forward posture. The curve does not disappear overnight, but the body quietly reshapes itself to what it repeats the most. That feels deeply reassuring in a way because it shifts this from damage to adaptation. I hear that a lot from seniors who feel betrayed by their own bodies as if something suddenly went wrong without warning. Yes. And this is where misunderstanding causes harm. Many older adults chase pain relief without realizing the pain is only the signal, not the source. When the lower cervical spine stays flexed for years, the upper neck overworks to compensate, and that imbalance becomes the new normal. Over time, the brain even accepts this altered position as safe, which is why stretching the wrong area, snorts, often feels useless or short-lived. That explains why so many treatments feel good for a moment, but never seem to last. Exactly. And this leads us forward to something very practical. Before any exercise can help, the body needs clarity about where the problem truly lives. If we miss that spot, even the best movement loses its power. Okay, so before we talk about the exercise itself, I'm curious how you guide seniors to find that exact place in their own neck safely and confidently, because that feels like the turning point that changes everything. That's exactly the turning point, John, and I'm glad you asked it that way. Start by remembering that the neck gives us clues if we listen gently. That's why I guide seniors to use their own hands, because touch restores awareness before movement ever begins. When you feel where the structure changes, the body immediately understands where it needs support. That feels empowering already because it gives control back to the listener. I hear that a lot in older adults who feel unsure about touching or moving their neck on their own. That's understandable, and this is why calm matters. So to find their exact spot, I ask them to sit comfortably, relax the shoulders, and slowly trace the spine with their fingers, starting lower, where the upper back begins. One vertebrae will feel more prominent and steady than the rest, and that landmark becomes our reference. When they gently extend the neck and notice which bump disappears and which stays, the picture becomes clear without pain or confusion. That small moment of recognition seems like it could change how safe the whole process feels. Yes, and here is the quiet promise I want listeners to hear. Once you can locate that spot with confidence, the exercise stops being a guess and starts becoming a conversation with your body. Precision brings relief faster than effort ever could. That makes me lean in, because it sounds like the exercise itself only works when this awareness is in place. So, I'm curious how you translate that exact spot into the movement you trust most for cervical rectification. Well, let me explain how I translate that awareness into action. The exercise I trust most is simple, but it is precise. And that precision is what makes it effective for seniors. Once the correct vertebra is located, we use a small folded towel placed exactly at that level to guide the movement. The towel does not force the neck. It reminds the lower cervical spine how to extend gently. Again, that immediately sounds different from most neck exercises people are shown. I hear that a lot in my patients, that they have stretched their neck for years without knowing where the movement was really coming from. Yes, and that confusion is very common. I ask older adults to sit upright, relax their shoulders, and hold the towel lightly with both hands so it rests just above that prominent vertebra. From there, they gently press the towel forward and slightly downward, while allowing the head to extend back slowly as if looking toward the ceiling. The movement is held for about 5 seconds, then released and repeated 3 to 5 times with calm breathing. That feels slow, controlled, and surprisingly respectful to the body. Exactly. But this is not everything. The body responds not to force, but to clarity and consistency. When this movement feels precise and comfortable, it means the neck is finally being invited to change. That makes me curious about how seniors can fine-tune this movement, because I imagine small adjustments could make a big difference in how it feels and how well it works. Yes, and this is where small changes create meaningful progress. The key here is that seniors do not need to push harder. They need to become more precise. By folding the towel thinner or thicker, you can gently control how focused the movement feels in the lower neck. When the pressure feels clear but comfortable, that is the signal the exercise is working with the body, not against it. That reminds me of so many older adults who assume more effort equals better results. I hear that a lot. Seniors who are afraid they are not doing enough. Yes, restraint is often the missing skill here. I always encourage my patients to slow the movement even more, keep the breath steady, and stop the moment the neck feels strained or guarded. Research from the Journal of Orthopaedic and Sports Physical Therapy in the United States has shown that gentle, low-loaded cervical extension performed with precise positioning improves comfort and movement more reliably than forceful stretching in older adults. This tells us the nervous system responds best when it feels safe. That makes this feel achievable instead of intimidating for after 60 bodies. And there is one thing many seniors find surprising. Once the neck begins to trust this movement, gravity itself can become a gentle ally rather than a threat. And there is a second technique that builds on everything we have discussed, and it often deepens the results. Okay, everyone, please stay with us, because the next part is important. Using gravity sounds both simple and powerful. So, how do you guide older adults to do that safely without fear or strain? I usually guide seniors by calling it a gravity-assisted cervical extension, and it begins with reassurance before movement. You start by lying on your back on a bed or sofa, positioning yourself so the upper back is supported while the head can rest just beyond the edge. From there, you simply allow the head to tip back naturally and stay there for about 40 to 60 seconds, breathing slowly and doing nothing else. That immediately sounds calmer than most exercises people imagine. I hear that a lot in older adults who tense up the moment they think they have to move their neck. Yes, and calm is the treatment here. I remind my patients that this is not stretching. It is letting gravity do quiet work while the muscles soften. A study from the University of Tokyo observed that short supported cervical extension using gravity reduced neck stiffness and muscle guarding in older adults without increasing discomfort when done for under 1 minute. When seniors know there is a time limit and a clear end, fear melts away. That sense of safety feels like it would change how willingly someone tries it. And this is where I like to pause the conversation for a moment. These techniques work best, not because they are powerful, but because they are respectful. Once the body feels that respect, change comes more easily than most seniors expect. That makes me reflect on how often we overlook consistency. So before we close off, I have one more important question. How often you recommend seniors practice these movements and what they should realistically expect to feel in the first few weeks? Well, let me explain how I frame this for older adults. The key here is regularity, not intensity. So I usually recommend practicing both movements once or twice a day. The towel-based exercise can be done in 3 to 5 gentle repetitions, holding each extension for about 5 seconds, while the gravity-assisted position is best held for 40 to 60 seconds. When this becomes part of a daily rhythm, the neck begins to soften and respond rather than resist. That feels refreshingly manageable, especially for older adults who worry about overdoing it. I hear that a lot in my patients who are afraid they might make things worse. Yes, and reassurance matters early on. In the first week or two, most seniors often notice subtle changes like easier head movement, less morning stiffness, or fewer tension headaches. Japanese clinical observations from rehabilitation centers have shown that consistent low-loaded cervical extension practiced daily can improve comfort and posture awareness within 2 to 4 weeks, even without aggressive intervention. These are quiet improvements, but they signal that the body is relearning balance that helps set expectations without promising miracles. And the story continues beyond the exercise itself. Movements alone cannot undo habits that reinforce the same stress patterns every day. Before we close this episode, we must understand that what seniors do between exercises often determines how lasting the results become. Are you saying that daily habits could either protect this progress or quietly undo it? So, what should older adults start paying attention to in their everyday routines? Well, the neck does not forget what it experiences most often. Even one strong exercise session cannot outweigh hours of quiet strain from daily habits. So to everyone listening, please notice moments when the head drifts forward, especially during phones, tablets, or television, and gently bring the screen up instead. This simple reversal reduces constant flexion and allows the neck to hold the curve it is relearning. That feels very real because those moments add up without anyone noticing. I see that in my patients who swear they sit well, yet still spend hours subtly leaning forward. Exactly, and chairs matter more than people think. Soft seating that lets the spine collapse often pushes the head forward without effort. So, I encourage older adults to sit where the back feels supported, and the head naturally stacks over the shoulders. Even how pillows are used at rest plays a role since too much height quietly reinforces the same pattern overnight. When daily positions match the intention of the exercises, the neck finally receives one clear message instead of mixed signals. That makes it sound like alignment becomes a habit rather than a task. Yes. And that is the shift I want listeners to feel. When posture becomes awareness instead of correction, the body relaxes into change instead of fighting it. That leaves me thinking about the emotional side of all this because for many seniors, this is tied to frustration or self-blame. So how do you help them let go of that as they move forward? I'd remind seniors that the body was never failing them. It was adapting the only way it knew how. When you replace blame with curiosity and kindness, the neck softens, the mind settles, and healing finally has room to begin. That really stays with me because it turns this from fixing something broken into caring for something loyal. So let's end it here. To everyone still listening, you are amazing. Please like this video by pressing the thumbs up button and subscribe to the channel. Oh, and watch this next video right now. Yes, please. We've picked this one especially for you. Or